Dr. Henning Onsorg from Santa Barbara County Public Health is joining us here on Midday. Good to see you again, sir. Let's start with these booster shots. When will Santa Barbara County residents be able to get them? We know the administration said the end of September. Is that what we're looking at here too? Dr. Onsorg, for whatever reason, we can't hear you right now, so we're going to have to...
I was muted.
Oh,
I apologize.
you were muted. That's okay. It's our first Zoom mishap in the year and a half we've been doing this. That's okay. You get a pass. So go ahead. When it comes to booster shots, what are we seeing here?
As of immediately, or as of last week, people who have significant weakness in the immune system because of medications like chemotherapy for cancer or immunosuppressive medicine for autoimmune diseases and the like are now eligible for a booster shot if it's more than a month after their second shot. They need to call their primary care physician or their specialist and make arrangements for that. Now, for the whole population, it is slated per President Biden and the administration to start after September the 20th. And it should be 8 months after the second shot for anybody who's received the first 2 shots.
Seemed like a pretty quick shift here. I mean, a week ago you had people like Dr. Fauci saying there's no evidence that you need a booster shot. And then yesterday they come out saying that you need a booster shot. What has changed? Is it the Delta variant?
Yeah, there's several factors here. One is that early this week, a couple of studies came out that gave us some hard data on how much the immunity actually wanes over time after 6 months, to be precise, and that helped in making this decision. Now, I want to stress that the immunity doesn't wane significantly for most people, even after 6 months. It's very robust still. However, the Delta variant is more aggressive, as you just alluded to. It does infect even fully vaccinated people, and that is concerning. And I think those 2 factors, that we have more data on how much the immune system or the antibodies do go down, and the more aggressive Delta variant, I think that gave the CDC enough arguments to go ahead with this new plan.
So this is for Pfizer and Moderna. Santa Barbara County has given out a lot of Johnson & Johnson over the last, whatever it has been, 9-10 months since it's been eligible. What about for those people? Still waiting to find out.
Yes, we are. We are still waiting for data to come out very shortly, and I anticipate a recommendation to come out on the Johnson & Johnson very soon.
The LA Times had an interesting article today saying that in California anyway, it seems like we may have hit our peak when it comes to Delta cases, at least now. It's gone up 7% from last week, which was up 30% from the week before, and then it was 85% in June. I don't know if you've seen this report or these studies. Have we reached a peak of Delta, at least here in California?
Well, that answer is tricky because it requires a nuanced answer. Your question is a little bit complicated. If you take the whole state, yes, the numbers are right. However, there's so much volatility in these virus transmissions. There are so many factors that come into play that is very difficult to predict. Our predictions have previously been wrong more often than not. So I'm a little bit more cautious that we already reached the peak. I'm not sold on that yet. So in Santa Barbara County, we are still not at a peak, and our hospitalizations are going up. So I don't think we are there yet.
You know, we're always telling people to get vaccinated. We play a lot of sound bites from doctors saying get vaccinated, but the proof is in the data. In our hospitals right now, are there vaccinated people that are hospitalized or on the ICU or on a ventilator, or is it predominantly unvaccinated folks?
Predominantly. Now, hospital data always lag behind. We do have the data from May to end of July. And during that time in Santa Barbara County, 100 people were hospitalized for COVID, and 88 of them were unvaccinated. So 12 people out of 100 were vaccinated. Now, none of them were in the ICU, and let me rephrase that. The minority were in the ICU, and I'm actually receiving all hospital charts of all those patients and we'll review them because I'm concerned that maybe somebody was admitted for, I don't know, a knee replacement or something and was asymptomatic and because of the testing prior to the surgery was tested positive. So I'm a little bit cautious, but definitely some people with COVID after vaccination still end up in the hospital. And that is a new development that we didn't know a couple of weeks ago.
Let's talk about schools. You know, Santa Barbara County schools kicked off last week and this week. We've seen a lot of kids heading back. Have we seen a rise in cases due to the Delta variant of adolescents with COVID?
It is very fresh. We do have one adolescent in the hospital, unfortunately, right now with COVID. So it does affect children more so than the old virus, apparently. Also, it's concerning because kids under 12 cannot get a vaccine. So we would really encourage everybody, all parents, to get their kids 12 and older to get vaccinated now. So we are actually really, ready for any outbreaks that may occur now with the opening of schools. And we have a very strong and dedicated team to help the schools manage that if they occur.
Now, this is a question you may not have a good answer to right now because it's so new, but there are examples out there of people needing to get a COVID test to go to a concert or an event, a conference, whatever it may be. Yet there are people that may not be feeling well at a certain time that then cannot get a COVID test because that comes up, day of, and they're concerned. Santa Barbara County dealing with that in any way? Is there a program that may be rolled out soon so people that just need the proof to go to an event can get a test, at a certain site, and other people that aren't feeling well that maybe have to wait a little bit can then get tested at another facility? You see what I'm saying? Like the tests are all full. You can't get a test right away.
Well, the good news is there are also home kits that you can purchase in the pharmacy, 2 tests for $26 at CVS, for instance. So it's $13 a piece. And that would be sufficient to enter a venue where that's required. So I would encourage people who don't feel well to actually see their doctor or go to an urgent care and not go to one of these public testing sites. Because that is concerning to me that if somebody is, symptomatic, they shouldn't stand in line and potentially infect other people. They should see their doctor or call them or an urgent care place.
All right, Dr. Henning Ansor giving us an update on the local situation when it comes to COVID. Thanks so much.
You're welcome.